adult. Their bodies are changing and sometimes feels out of control. And for mom and dad, it's often difficult to offer the level of independence they are so desperately seeking. To discuss ways to make this transition as smooth as possible, join me in welcoming Brittany Holmes. Brittany is a nurse practitioner at Yale University's Department of Genetics. She sees a wide variety of patients with rare diseases at Yale New Haven Hospital and specializes in inborn errors of metabolism. She also participates in research projects through Yale for patients with metabolic disorders. She received her Bachelor's of Science at Merrimack College and Master's of Science in Nursing from Simmons University in Boston. Her interest in working with inborn errors of metabolism began at a young age due to her personal experience as a patient with the rare disorder PKU. She spoke at conferences from the patient perspective, which ultimately led to seeking a career as a healthcare professional in this specialty. She enjoys being able to offer both the provider and patient perspective and has a passion for caring for patients in this specialty. Joining Brittany later in her presentation will be a wonderful group of young adults who will share their real-life perspectives. We will take questions at the end of the presentation, so be sure to enter them throughout the session in the Q&A. Please join me in welcoming Brittany Holmes.
Thank you, Kyra. Hi, everyone. So as Kyra said, my name is Brittany. I work at Yale as a nurse practitioner, and I do see a lot of different metabolic disorders, definitely a lot of FAODs. As Kyra also mentioned, I do have a rare disorder myself. I do not have an FAOD, but I have a disorder called PKU. If you were in one of the earlier sessions where they discussed newborn screening, you might have heard them mention PKU. My management has obviously been different, but a diet restriction is a big piece of it, along with some other things. So, you know, going through life transitions with a rare disorder is something I have had experience with. And then, of course, you know, I've seen it through our patients with FAOD at work. So hopefully I'll be able to offer a little bit of both perspectives. And so today we'll just be going over the life transitions throughout, you know, from pediatric to adult. Those are just some disclosures and my information. So today we're going to start by just doing a brief poll so I can get a sense of the ages we have on here, and then we'll review some common challenges and how to prepare for those challenges, and then discuss some real life examples, some case studies, and wrap up with just some general pointers for life transitions. So let's start with this poll. So this is going to be a poll just for the current age ranges. Kyra is going to put up the poll shortly. You should see a pop-up. And so if you are a patient with FAOD, answer for your age. If you are a parent of a patient with FAOD, you can answer for their age. And it can have multiple answers. So, you know, you can select two if you have more than one child. So take a minute to do the poll. Give you a few seconds to answer here. Right. Waiting for a few more votes and then we can move on. Okay. Let's see what we got for results. Okay. So it looks like we have a good distribution with the 13 to 17-year-old being the most common here. So that's great. So now we'll move on. So with life transitions in general, everyone experiences these. You know, this is something, rare disorders aside, this is something everyone goes through, whether it's age related, you know, going into school, or whether it's a transition into a new job, new house, anything like that. Everyone goes through types of these transitions. Now add a rare disorder or FAOD into the mix. This involves some additional challenges. Not everyone will experience the same challenges, and some may occur at any age, so they don't necessarily stick to a timeline. We'll be reviewing them today in kind of a timeline format just to make it easier to see when some of the common challenges may present, but some of these might present at different times, so don't think that they necessarily all stick to that same exact timeline. And then discussing common challenges, really at any challenges that may occur can help prepare with whether they arise at any age. So beginning with this early stage, the 0 to 4-year-old, this is a time where a big challenge obviously is just coping with learning about this new disorder, having a new baby, especially for new parents. This can be a really scary time. Any parent here, I'm sure you can think back and remember that time. Not to mention with FAOD, there's additional challenges of waking the feed frequently, not letting them fast. Picky eating is something that we see in this age regardless, but with FAOD, we don't really have the luxury of not worrying too much if they skip a meal because they don't like what's in front of them. So we tend to, sometimes give in to things like junk food because we get nervous about them not eating. So picky eating can definitely be a challenge for this age and with the disorder. Refusing meds and supplements, this age is a time where they don't really understand their disorder very well, so they don't understand why it's necessary to take these meds, especially if they don't like the taste. It's something they're not going to want to take. And then fear of hospitals and blood draws. Obviously, many kids do not like needles and they do not like to get their blood drawn. And, as a parent, this can be something that causes anxiety because obviously you don't want to put them through that, even though you know that it is good for them, but obviously they're too young to understand that it's good, that it's something they need to do. And the last point about being too young to understand the disorder kind of helps describe the other challenges because, since they don't understand well, that's why, they might not eat as often as they should or want to take their meds or all those things. So preparing for some of these. First, start discussing the disorder as early as possible. Obviously, infancy is not going to happen, but once they get old enough to, start discussing the very basics. Start in a place, a very basic place where they can just, if they start going to daycare or being around friends, they might be able to say something basic like, if I do this, it might make me sick, or if I don't take this med, I might get sick. So something very basic to start. And then start involving them in things that you can, like giving them choices for meals and snacks. This lets them have a little bit of a sense of control, but obviously you also have the control since you are providing the option. So, say, would you like this cheese stick or this fruit or, this rice cake or pretzels? Give them a choice so that they feel like I chose that, that's what I want to eat, but you're giving them, choices that are good for them. And then having them participate in their meds or diet or whatever, their management involves as early as possible is really helpful. So obviously this is, too young for them to really measure things out themselves or take it completely independently, but giving them, like a pre-measured med. So I've seen parents, if they have to take it in a syringe, they might measure up the med in the syringe, give it to the child who can, take it like that. Or if any mixing is needed, like if, they don't like the taste and you're mixing in some flavor additive or mixing it in juice, let them choose, the flavor or the juice. You can also kind of make it a game, like, set a timer and I bet you can't finish it in this amount of time. That can sometimes make it fun for them too. So trying to get them involved in any way you can as early as possible. And then, any supplies that you have, keep them organized so that they can help, obviously nothing hazardous, but, something that they can help gather, because then they feel like, I'm helping mom get this stuff ready for me, or dad, or whoever's helping. So now moving on to the next age range, this school age. So this 5 to 12, when kids start going into school, the challenges here are, a little less monitoring. So, before this, parents were pretty much controlling almost everything that was going in their mouths, everything they're eating. Sometimes we see a change in eating habits here, especially as they start seeing other kids and what they eat and wanting to eat those as well. Also just being more active, expending more energy, playing with friends, even, starting to participate in sports. So that can obviously be an additional challenge for someone with FAOD. After school activities as well. So if there's longer days and maybe, after the school is closed, there might not be access to the cafeteria for snacks or food. And then navigating school challenges in general can be difficult. So just finding, available services, options in the cafeteria, missing school for, illnesses or for clinic appointments, and sometimes difficulty with school is not accommodating. I know I had a patient whose school did not allow snacks and drinks in the classroom. So that obviously is a challenge for someone with FAOD who needs to have those available. Hospitalizations, this is a challenge that really can be at any age, but can impact both mentally and physically. So obviously there's the physical aspect of recovering and missing school and things like that, but also mentally from the anxiety, and both for the parents and the child, there's an anxiety there of if it's going to happen again. So preparing for some of these challenges, again, having them involved as much as possible. So plan and prepare meals together. Involve them in the grocery list. So, this allows them to start exploring, their preferences and interests. And then later on, when they grocery shop on their own, again, this first step is already done. So that makes it a lot easier. Preparing meds together, just like when they were younger, but now you can kind of move a step forward. So, they're getting to the point where now they can measure it out on their own as well. Using visual trackers or, things like stickers, boards, to help track whatever you need to track, whether it's, diet or meds or intake. This was something, me from the patient perspective, I can give you an example. So for PKU, it's diet that is really a big component. So I would have a goal of grams of protein I could have for the day. And when I was young and couldn't really track this fully myself, my parents had this little magnet on the fridge that had a wheel, and it had, the goal of the full amount that I needed for the day. And they would tell me, Brittany, you just ate 2 grams of protein, so go spin the wheel. So I'd spin the wheel 2 grams. And it was a good visual for me and a way for me to start, helping track and help get involved with my diet and understand that it's important to track. Role playing is another good way just to help practice responding to certain situations. That way, when they go off and do it on their own, people ask, why do you have to drink that? Why do you have to eat that? Why can't you do that? They're comfortable with answering because you've kind of already practiced and they know how to explain it to people. And then having a plan in place for longer, more active days. So, those days where they might not have access to the cafeteria, make sure they have snacks on hand, extra meds if needed, all those types of things. And then letters, that can be helpful for that scenario I just mentioned in the last slide where the school didn't allow snacks and water in the class. This is where your healthcare team can also help you. So what we did in that situation was we wrote a letter so that the parents could give to the school and say, this is why my child really needs to make sure they have these things on hand. And that was, and that helped. Okay, so on to the next poll here. So this is actually going to be a case study. So you can see here, Johnny is a 10-year-old and he's preparing for a sleepover at a friend's house. He has LCHAD and his management includes a low-fat diet and medications, along with some other things. His parents manage most of this for him. So what should he do here? Should he not be allowed to attend because he's not really ready to have a night with his parents around? Or should he be allowed to attend, but his parents prepare specific food and snacks for him, as well as all of his meds, since he can't really do this alone yet? Or should he be allowed and let him help pack his own snacks and meds and suggest that he pick something, that maybe both him and his friend can enjoy? So I'll give you a few minutes or a few seconds, however long it takes for you guys to try to answer this poll. Okay, it looks like we got the majority voted now, so we can just move on. So it looks like the majority said C. That's great. So we can close this and discuss. So there's really no wrong answers here. Really, the goal is to progress to be as independent as possible. So a lot of you chose C, which is, definitely the goal eventually. However, not all children get there at the same time. So you and your child are really the best to assess readiness. You can also ask assistance from the care team because obviously sometimes as a parent, obviously want to protect your child as well, so you want to make sure that they are ready for these things. But everyone, you know, might get there at different times, but the goal is to be as independent as possible to progress there. So now moving on to this teen years, which I believe is the majority of the people that we have here from the poll. So challenges here definitely include this rebellious stage. I mean, even with children, you know, in children without rare disorders, there's this rebellious stage. But with a rare disorder, it might look like, you know, someone also rebelling with their care, rebelling against having the disorder. You know, they don't want to worry about this, especially, you know, I think we see this in kids that are more mild as well, because obviously, you know, they may have not seen the effects as much and might try to push boundaries a little more. So that's definitely a challenge at this stage. Also some, you know, even more less monitoring than earlier years. You know, they're getting older, they're a little more independent, but still not fully independent with their management. Schedules sometimes get busy too, you know, a lot of activities running around from one thing to the next, whether it's extracurricular, sports. And then there's the fear of allowing more independence. So, you know, I can't tell you how many times I heard you know, something along the lines of, well, you know, if a child is not really doing much for their management, I hear from parents say, well, you know, I'm afraid if I don't do it for them, they won't do it at all. I hear that a lot. And I'm sure if we polled, there would be people that say, you know, they have that same concern. Social activities, you know, just involving food, involving being out and about, expending more energy can be a challenge. And then just the impact of adolescence in general is something we have to keep in mind. You know, this is a time where there's hormonal changes, you know, where it's an extra metabolic stress, and that's something that, you know, sometimes we see patients be less stable, and so it's even more important to stay on top of care. So preparing for these challenges, you know, at this age is really where it's important to start trying to shift being more independent with management. So, you know, as I mentioned, this mentality of if I don't do it, they won't do it. It's definitely something common I hear. But trying to start the transition in small steps when possible. You know, if you're able to are doing, but you know, take more control. I know from the patient perspective, there were times where I knew that if I didn't, my mom. So sometimes why you might see kids not taking over, because, you know, they know that their parents will do these things for them at this age if, you know, they don't do it first. So this is something that, you know, you want to start in steps. Establishing a routine is really helpful. This is something that, you know, can help with anything really. You know, consistency is key, especially with busy schedules. Keeping stocked of favorite snacks, ready-made things so they can grab and go, especially on busy days. And then these portable med holders can be helpful if, you know, they have to have meds on them, especially if it's someone that needs to take like MCT oil before activity. You know, make sure they're able to have it on hand as needed, especially for those longer days. And make sure they fully understand their disorder. So obviously, you know, I think parents understand it really well because you had been having conversations since they were young. But, you know, continue these conversations with the child as needed. Encourage them to ask questions in clinic too. You know, I always, you know, want to make sure that the patient understands as well as the parent. So just, you know, keep that communication going and ensure why they, you know, that they understand why adherence is so important. If any documentation is needed, like the emergency protocols, things like that, it can be helpful to have them have a copy on them as well. One, just to start, you know, again, transitioning responsibility, but also, you know, if anything were to happen when their parents weren't around, at least they have a copy on them. Using reminder tools is another way to start giving more responsibility. So now instead of you reminding them to take their meds, you know, they're taking a step towards reminding themselves, setting their own phones for alerts. And then learning about, you know, especially if this is someone that diet is a big component, learning about, you know, the healthy foods, nutrition contents, how to read labels and track independently. You know, this is something that is, you know, important thing for them to be able to start doing themselves. And using things like apps like MyFitnessPal are things that our patients have used to be able to track these. And then assisting them with being more comfortable requesting, you know, modifications at restaurants if they need to, and things like that. That way, you know, when their parents are not around, they're still able to do that themselves. Joining support groups is something I always strongly encourage. And there was actually research behind this that shows that that adolescents with rare disorders really benefit from being able to talk to peers. And me being from the patient perspective, this is something that I feel like was a big game changer for me. You know, I was in support groups since I was young and going to conferences and things like this and meeting others with, you know, PKU with the same disorder as me, and having them to talk to and even still talk to this day, I think was really helpful. So I always encourage people to do that, you know, continue going to things like this. It makes a big difference. All right, so moving on to the next poll here. This is another case study. So this poll should come up in a second, and it's about Peter, who's 15 years old with CPT2. He recently made the soccer team at school, so he'll obviously be more active, have longer days, since the practices and games will be after school. He's been doing well managing his medications on his own, so what should his parents do? Should his parents rearrange their schedule to attend all practices and games and bring, you know, snacks and meds for him and stay with him, maybe stay on the sidelines to monitor him and make sure he takes everything he needs? Should they speak with the coach ahead of time, make him aware of Peter's disorder, and ask if they can make, you know, he can monitor Peter and make sure he takes breaks and that he needs and takes his meds? Or last year, let Peter discuss his disorder with his coach and team and allow him to make sure he brings snacks and meds. And then of course the parents will still attend, but just, you know, sit with the other parents and not on the sideline. So we'll give everyone a few seconds to answer this. All right, it looks like we've had the majority, just about the majority voted here. All right, so we can discuss these now. Okay, so it looks like the majority said the last one, still some for B. All right, we'll move on. So again, if you haven't figured it out from the last one, there's really no wrong answers here. This is something that you even may start out being more involved and progress, or there's a combination, you can, you know, do a combination of an approach. And what I mean by that is, like, you know, so for the last example, maybe you let Peter or your child discuss with his team, his coach and teammates, but then you also discuss with the coach so that, you know, you just kind of like an extra check, just make sure that he does understand everything. So, you know, that's a way to do a combination approach, still make sure that they do have some independence there, but are still safe. And then really, again, the overall goal will be to progress to that most independent scenario. Okay, so moving on to this young adult stage, which we will hear from these young adult panels after this as well. So challenges here is really this transition to more independence. So, you know, a lot of kids might be going away to college or just, you know, moving out on their own for the first time. So you might be away from your support system. You know, from my experience, I know this was one of the most challenging times for me, just because I rely on my parents for some things in management. Now this was the first time I was really off on my own and away from my support system that I had had since I was young. So this kind of leads to stress of managing, you know, all their own care now. So now, you know, things that maybe they had their parents to help with before, now they're almost all on their own for. So that can lead to additional challenges. And then social activities at this age, plus the college environment, can be difficult. You know, things like people loving pizza and Taco Bell, maybe not the best choices, or even, you know, drinking. That's something in college that, you know, we get concerned about regardless, but then, you know, with FAOD and that additional stress there, that's something that can also be concerning. But even just, you know, things like parties and drinking aside, just having longer days, you know, studying late, being stressed about things like that. So that college environment can lead to additional stresses. And balancing health and school or work, depending on, you know, what they're doing, that can be a lot as well, because, you know, just doing school and work and keeping up with that is a lot, but then making sure that you are taking the necessary breaks and things like that is important and can be a challenge. Communicating with care providers effectively. So in the past, this was probably something that parents did a lot of and maybe still do a lot of, but now as an adult, we actually can't even, you know, talk to your parents without having a release sign. So this is when, you know, the transition can be a little tough because you might not be used to that. Navigating dating and relationships can be a challenge as well. You know, always explaining the diagnosis to new people, especially if you are on some type of restricted diet, or, you know, have to really watch what you eat, and you have to explain that when you go out to dinner, things like that. And busy schedules, you know, that's something, again, can come up at any age, just trying to balance everything. And travel, you know, this is an age that people might travel more for any reason, or even traveling abroad for schoolwork, things like that. So, you know, thinking about food options and carrying meds can all be a challenge. So preparing for some of these. It's definitely important to continue that transition, that process of taking more control over your care. You know, as I mentioned, this is the stage where you're actually an adult. So taking over that more, especially, you know, starting with taking responsibility for some clinic communications. And that can be something that can take some time. I'm not saying, you know, right at 18, you're on your own. You gotta make sure you do all this. But, you know, starting to communicate with clinic directly, making your own appointments maybe. Even having access to your, you know, if you have a patient portal, so you can communicate that way. We find a lot of the younger ones prefer, you know, communicating electronically versus by phone. Always having important contact info on hand. That way, you know, if you need it, you have it just in case. And being able to order meds independently. So if this is something that, you know, the parents did before, making sure you set alarms, you know how to refill your meds. If it needs to be shipped, you know, maybe try shipping it to you instead of your parents' address, things like that. And discussing with colleges and cafeterias beforehand. So if you're going away to school and you're going to be living there, you know, just checking to make sure things are available, like if you need fridge access, if there's enough food options in the cafeteria, you know, just checking on all of that ahead of time, and, you know, really be an advocate for yourself. And as a parent, you know, this is obviously something that I know when I went to college, my mom did help with this. I didn't do this completely independently, because she was, you know, really a great advocate for me as well. So this is something that, you know, discussing beforehand can be helpful. And then informing friends and roommates, you know, being comfortable with discussing this, especially with people that you are with every day, can be so important, because, you know, this can now be your new support system. So for me, that was a big help, was really, you know, having my roommates and my friends know about everything, and, you know, feeling comfortable around them, and that them really being my new support system. In fact, sometimes, you know, if we were out, I think they would be more worried than I was. So we've even seen that with patients. You know, their roommates are great when, you know, they're sick. They know how to watch out and call someone if needed. So having that support system is really important. And then using apps on your phone. So for things like tracking, if anyone was in the discussion yesterday about MitoAction Mobile, you might want to look into that. Having ways to track whatever you need to track is really helpful. All right, so this is the last case study here. So this will be a case about Jessica, and that will come up shortly. And so Jessica is an 18-year-old, and she has GA2 or MAD, and she'll be going away to college. She's done well with managing her disorder, although still relies on her parents for some things, like making clinic appointments and things like that. So should she not go away to college, since she's still depending on her parents, and maybe just consider commuting? Should she go away to college but have her parents continue to help with managing things like clinic appointments and med refills? Or should she go away to college and bring important contact information so she can communicate with clinic and order her own med refills and things like that? So I'll give you all a little bit to answer. All right, it looks like we've had the majority vote here, so we can take a look at the results. All right, so majority said the last one, also some for the middle one again. All right, so we can move on. So, you know, as you know by now, obviously, this isn't a right or wrong answer here, but really each individual needs to decide what's best for them. You know, I can't tell you as a blanket statement, this is what's right for everybody. But you really can, you know, even start with small steps. So it doesn't necessarily have to be one or the other. You know, you might even start with, you know, like that middle one, have the parents be still helping initially, and then progress to being more independent. Again, you know, progressing to most independent is the goal there. All right, so this last age group here, adults 25 and up. This is where, you're really kind of at the point where you have independence with care. But some patients still might have difficulty at this point, really transitioning, still might rely on parents for some things like clinic appointments. And then another big challenge here is just managing the disorder with normal life stressors. Adults have a lot of responsibilities. So adding a rare disorder is just, another additional stress. Dealing with insurance and medical costs can definitely be a big challenge, especially when you start, transitioning off your parents' insurance onto your own. This is something that, I know for me was always a fight. Every time I changed insurance, always had to fight to get things covered again. So that was, a stressor, and just, worrying about out-of-pocket expenses. And then discussing the disorder with others. So, being comfortable or, just always having to discuss this, being afraid of discussing things all over again or getting sick of always discussing it. I know for me, I had to drink a special like metabolic formula, and every time someone asked about it, I was like, oh my goodness, I have to explain this again. So, things like that can be a challenge. New jobs or job changes, anything that might change your routine might be an additional stressor. Difficulty with rights at work. So, if you're trying to fight, if you're having difficulty with things like needing breaks or taking time off for hospitalizations or clinic appointments. And then just times of increased stress, so like financial stress or life changes, those are things that the increased stress can also be a metabolic stress, but also it can be difficult to be consistent with your care if you're also worrying about, something else that might be kind of taking over. Family planning is also something to keep in mind that can be a challenge because, this is a genetic disorder, but also with FAOD, you have to keep in mind for the females that this can be an additional metabolic stress, of course. So that's another challenge. And then treatment adherence. I mean, that's something that can occur at any age. This is not, just 25 and up, but treatment adherence difficulty can be a challenge. So preparing for these. First, having a medical proxy is important. This is something that, just in case anything were to ever happen, just so you have it so that they can help make decisions. And I always tell people, it is important to make sure that who you choose is someone that will follow through on your wishes and not their wishes. So make sure you have the right discussions beforehand. And then maintaining a support system. So your support system is still important, in any time in life. And that can include friends. It can include family. You can still have your family as your support system. Just try not to rely on them for your care. And then being comfortable with informing colleagues. So I always, also suggest informing your colleagues, people that you work with every day. It's helpful for them to know, but also so that then you have another support system there with people that you're with frequently. Being aware of your rights is important. So, whether you have FMLA, what your breaks look like, that can be something that you want to do ahead of time. And then even with the FMLA, if it's available, you can ask your clinic to help. That's paperwork that I've filled out for both, parents and patients before if needed. Always having snacks available on hand. So I know I've mentioned before, being prepared is super important because, you never know if you're going to have maybe like a late night working, or even if that's not a concern, maybe just a day where something unexpected happens. There's an accident on the highway and it takes a long time to get home, or it's just a more active or stressful day. Those things, make sure you do have snacks available and you have water available and beverages, and keep that on hand. Planning ahead for travel is really important as well. Have extra meds in case something happens, like you get stuck, flights get canceled, and really important to keep some in your carry-on and not just all checked luggage, because sometimes that goes missing. Having a letter if needed too, that's something your clinic can help you with if you have liquids. And then I also always suggest bringing like an empty bottle through TSA, because obviously you can't bring full water, but you can bring an empty bottle, and there's usually fill stations, and then that way you can make sure you always have some water on you or some beverage. Family planning is something really important to discuss with your clinic team before you start a family. And I know that sounds kind of obvious, but we do get a lot of people that, present to us when they've been, just found out they're pregnant. But because this is a genetic disorder, making sure that you go through some genetic counseling, and then also, making sure that your clinic team can put a plan in place to make sure both you and the baby are as healthy as possible. So try to discuss that beforehand. And of course, use your clinic as a resource. Questions, concerns, don't feel like it's a bother. That's what we're here for. So use your clinic team as a resource. And if they have any additional resources like social work, they can help sometimes with these, insurance issues and just life stressors in general. So try to use that as a resource. So overall general considerations to wrap up here. These challenges, as we talked about, can really appear at different time periods. They may overlap through different life periods. Like adherence difficulty is an example. That's probably not something that will just stick to one age. It might be something that will come and go, or just go across, the lifespan. And not all individuals progress at the same speed. Just like kids don't all ride a bike at the same exact age or things like that. Everyone progresses differently. So it's really, you to assess your child's readiness, and both patient and parent to help determine the individual readiness. But I think it's really important to also know that it's never too early or too late to engage in their care. So I don't want people to see this presentation and think, she wrote that they're supposed to be doing this at around 15 years old and he's not doing that yet. What, am I totally behind? It's okay. Like I said, everyone progresses different. Just because, they're not at that stage, is not the end of the world. That just means, it's something to work towards, something to progress to. And then we've talked about this a few times. It's come up. Be an advocate for yourself and your child, and use your resources. Super important to use your resources. I, sometimes see people that are afraid to kind of, ask for help, but, using your resources can really make a big difference. And there are these general guidelines, these general transitions that we talk about in general recommendations, but there's really no one size fits all or no cookbook approach. What might work for one might not work for another. So, don't get discouraged if your child or your management needs to be different from someone else's. And with all transitions, you could just start somewhere. Starting somewhere is helpful. And then you can just progress in small steps as, appropriate for you or your child. I also like to wrap up by saying, rare disorders, obviously, with FAOD, with any rare disorder, it's going to be a big part of your life, but it doesn't need to completely define your life. People with rare disorders are strong, they're resilient. Obviously, like I said, it's still a big part of your life. For me, I wouldn't be doing what I'm doing today if it wasn't for the fact that I had a rare disorder. But, still leave room for other things in your life, other hobbies, passions, use it to motivate you. That's something that, when I say I'm Brittany, I'm a nurse practitioner, I love, I'm a fitness lover, I'm hopefully a good daughter and friend, and I also have PKU. I'm not Brittany, I have PKU, and that's it. So that's a thing I like to leave with is, obviously it's going to be a big part of your life, but, use it to motivate you, and it doesn't need to, define you and not have room for anything else. And you'll see that soon with these next patient panels who have definitely been able to still do big things. All right. So we can take, are we taking questions here or just moving right into the panel?
We're going to move right into the panel. Brittany, if the panelists can unmute themselves and turn their videos on, we can get started with.
All right. So I hope everyone can welcome me in joining the panel. Let me just stop sharing my screen here so you can see everyone. There we go. Okay. So we have panelists that I'm going to introduce, and then we can get started. So Ali Ahmed. Ali lives in Boca Raton, Florida. He's currently a graduate student at Florida Atlantic University, where he's earning his master's in biological sciences. He's diagnosed with VLCAD. Next, we have Jordan Kalick. Jordan is entering his sophomore year at the University of Florida. He's 19 years old and is from Jupiter, Florida. Jordan was diagnosed with oxidative phosphorylation disorder and fatty acid oxidation disorder at 1 year of age. Kylie Newman lives in Albuquerque, New Mexico. She's 22 and diagnosed with VLCAD. Alex Salser is 17 years old and lives in Sunnyvale, Texas, outside of Dallas. She's entering her senior year at Sunnyvale High School. Alex was diagnosed with Alchad when she was 1 week old. John Sullivan Baker, he's 22 and he's diagnosed with TFP. He lives in Toledo, Ohio. He's a 2020 Cornell graduate and will attend Columbia Law School in the fall of 2021. Tasia Racheski is a 28-year-old who lives in Massachusetts. Tasia is diagnosed with VLCAD. She attended undergrad at Boston University and is currently getting an MBA at UMass. And that is our panel here. All right. So let's just start jumping in by, we talked about adolescence and how that can be a very difficult time. And that also seems to be a majority of the ages we had here. So, this was a time that your bodies were changing, using a lot more energy. So how did you manage this transition to, balance activity and energy level and still make sure that you were able to, have time to socialize with friends and keep up with school?
I think making compromises in like situations that require it, like at school when I was for high school I did virtual school. I started that in middle school and high school, but in elementary school when I was going in person, I used a wheelchair. That was the compromise we made with my family. To do other things outside of school, saving my energy in school was the right thing to do. It also allowed me to kind of stay longer days. And then afterwards, I did virtual school for middle school and high school, which allowed me to do a lot more outside of class. I was able to join teams and do clubs. And then for college, I was able to transition to dorms my freshman year. So I think it's all just a gradual change of making compromises, making sure I'm doing the right thing eating wise, medication wise, just self-monitoring and self-advocating and making sure I'm always in the right situation to kind of succeed.
For me, sorry.
No, go ahead.
For me, I just added in more energy resources as activity level increased and things like that. As Jordan was saying, especially with school, it takes both mental energy and physical energy. And I had like a little tricycle scooter that I use at high school just to help accommodate that physical energy so I can use my energy for my schoolwork. So just kind of balancing out energy and seeing what works best for you and how to balance it all.
Yeah, I agree with them, and I think it's important to like prioritize your time, because it's not about just being organized so you can keep up with everything, but it's also about being organized so you can keep up with your health. When you have an exam coming up, you don't want to be out every night partying, and you also don't want to be up late studying. You need to make sure you're getting your rest. I found for me that sleep is really, really important, and that if you don't get the right amount of sleep, or if you don't sleep at the right time, you can be really negatively affected. When transitioning into college, you definitely need to get a lot of accommodations. Like I mentioned before, like I got a handicap permit so I could be able to drive around campus and park closer to my classes instead of walking really far. Stuff like that, just making sure your time is used wisely, because if you overuse your energy, then you're not going to be able to do anything else. So that's something that's really important.
And a definite thing for me too that's kind of been throughout this entire experience is figuring out how to best read my body and figure out where I'm at and how exactly I'm feeling. That's a skill that I've definitely working on, and I still as I'm sure the rest of you experience don't fully have that down yet, but kind of figuring out where my limits are, and then also learning strategies to manage if I do feel like I'm nearing a crisis or something like that. Although my experience is a little different than some of you, in the case that I was not diagnosed until I was 14 years old, so I didn't know I really had this until right in the middle of the adolescent period. Yeah.
For me, there was a lot of planning around what to eat, just how much I need to eat, if I was gonna go play volleyball with friends later, or if I was gonna maybe go on a hike with my family, just depending on that kind of thing. If I needed more fructose to add to my C7 formula that day, or I had to have more Gatorade that day versus just a normal water. So it was always watching how much I took so I could see how much I could do that day, and then try to work that around school, going to virtual school, or when I was in actual school. So
yeah, I think to elaborate on what Kylie said, that's definitely important. I feel like kind of just knowing your own limits, knowing how much you can day, maybe the day before is your rest and hydrate and whatever day. So kind of alternating. And I know that, and like not pushing yourself like on those days that you know you're just not feeling well, whether it's like your muscle aches